Well, thank you for the nice talks. And I am here in Brazil, and the situation is getting better. We are fulfilling all the requirements and vaccination and using masks and everything. But what we are realizing now is that we have a very large fraction of the population that had the COVID and they survive. And there is a fraction of that part that needs rehabilitation. People are coming out of the disease with a few problems, like neuro problems, a lot of pain, a lot of breathing problems, a lot of problems with taste and smell. And that is creating another like a group of people that they don't have COVID anymore, they survive, but they need the rehabilitation. So I appreciate all the parallel they made with cancer and everything. But let's see if we can also include what we need to do with people that survive, and they need to be reinserted in their work, in their common life, or in their usual life. Otherwise, we're going to have a kind of mountain of people that are unable to really be active in the society. So I just wanted to ask the two last speakers about what is the concern about rehabilitation for the ones that survive to the COVID, survive well, but they are coming with sequels, with post-COVID effects. Thank you.
Okay, I will ask to allow two more questions and then ask the speakers to answer. Joachim, please.
Yeah, thank you. I would like to ask a question to Dr. Pai. The presentation you gave us had shocking elements. Your statement, COVID broke the evidence pipeline and turned the pyramid upside down. What's your recommendation? What has gone wrong with the peer review system? What institutional approaches do you suggest to make sure that good science money is not wasted on bad research? So how should science policy respond? Have things gotten better over time during the COVID crisis? Have we learned some lessons, or is this problematic situation which you described actually ongoing? Thank you.
Okay, Volker, please.
Well, I do have also a question to the same presentation, or maybe a comment. I think it is very nice to hear about the analysis you have done or the covidization of research. But from my point of view, there is one mechanism which makes this possible, namely the tremendous number of predatory journals. We have the predatory journals have really outreached one of the established journals. And there is no peer reviews. This is only money which speaks that this is terrible that has happened. Universities and research institutions are probably aware, but they probably don't know how to control it. And I think this is something which the entire science community has to fight. And I think to develop some sort of a system how to overcome it, because this will ruin our science research activities and also the assessment of electing people to research institutions and university if this is not stopped at a certain point.
Okay. Professor Pai, do you want to answer this question first?
Yes, thank you for both the very interesting comments. I think one reason why the evidence pipeline broke and is still broken, in my opinion, is the extraordinary interference by politicians into scientific matters. There was a time when politicians would have deferred and said, this is not my space to make judgments on what treatments or what preventions or how to do things, that I will defer to my public health agency, my apex scientific institutions. But systematically, you can see even in just in 4 countries, US, UK, Brazil, India. Some of the leading scientists in the nation, public health agencies, were systematically eliminated from decision-making, and decisions were made by politicians who don't know the first thing about science. So it's almost like we need to find a way to make sure politicians do not interfere with scientific decision-making, because when they do that, it's absolute chaos and anarchy, because they drive the ship towards where it's convenient for them for their political gains. And we saw these 4 countries have lost millions of lives. This is not a trivial issue. When politicians interfere with science, people will die. And that is a cardinal example of what not to do in scientific decision-making. And WHO has been destabilized so much by politicians that even a WHO policy is not good enough now for anyone, right? People are constantly undermining WHO's authority. So now the question is, who is driving the ship? Whose evidence or judgment do I consider good enough? It's like free for all. And when you are in a free for all environment, somebody's tweet, somebody's WhatsApp message becomes amplified and misinformation pretty much takes over. And there's considerable evidence to suggest that misinformation is easier to go viral than a correct policy or a good science-based information. So fighting anti-scientific forces in the coming years is an absolute priority for all of us, regardless of which area of science we work in. We have to rebuild public trust and faith in science. We have to push scientists to make scientific decisions, keep politicians out of scientific decisions, and that is not easy to do. We saw exactly what politicians have done in these 4 countries as example, and we saw the kind of genocidal death rates in some of these countries. This is a massive effort for all of us. I agree, predatory journals are quite important, but I think medicine for many years lagged behind engineering and other sciences in the acceptance of preprints. One good thing that has happened is medicine no longer resists preprints. Now we are all comfortable in putting our work on preprint immediately, and preprints are not peer reviewed either. Now what then problem is, my problem is not with preprints. I'm fine with living with preprints. My problem is premature judgments on the basis of premature preprint evidence. Media, for example, have gone bonkers. They take anything and everything and write the headlines as if this is a settled issue. I saw this carnage happen live in my own country, India, and I said, this is ridiculous. Media is not able to separate a randomized trial from an observational study on a drug and is able to write as if the debate is closed. And they've confused the heck out of public, and they've confused the heck out of policymakers. That resulted in so much noise. So I started doing epidemiology training courses for media people. I did one for Indian journalists, one for African journalists, and one for North American journalists. I was stunned by what I learned. They all told me, we've been pushed into health reporting. We don't know the basics of public health. Nobody has taught us epidemiology or biostatistics or anything. We just report on health because it's a beat that nobody else wants. People are pushed into science and health journalism with zero background or training. They cannot tell an ecological study from a high quality randomized trial. They've created deafening noise levels and misinformation and amplified anecdotes and useless pieces of information that you and I would not consider valid science. So it's a multi-pronged answer. There isn't one way of doing it, but reducing political interference in scientific decision-making and educating media to be a lot more critical before they write anything, I think are very critical. Thank you.
Thank you very much. Now I would like to invite Professor Yao to answer this question about the rehabilitation.
Yes, I think rehabilitation is very important. I talked about long COVID. So this is part of the spectrum of the long-term consequences of COVID. And of course, there's a whole range of symptomatology and both in terms of mental health and physical problems. In fact, in Hong Kong, after SARS, we had a very good rehabilitation program for patients after SARS. So we have programs now that are being done in our hospitals, in our public systems, and in the universities, where we're following up a lot of the individuals with symptoms after COVID. So you're very right. They're very important things the rehabilitation, the longer term consequences. What can we do to get people's health better, mental health? And I also want to just put in talk about the evidence. I think Dr. Pai's examples are really very, very true and very dramatic. But there's another aspect, because I've been part of a working group in WHO looking at the role of science in policy. So in fact, we've done a study of experts interacting with policymakers, and of course, in those sort of experiences, the picture is very different. So I think one cannot just generalize to say from those things that science is not respected. I think certainly in those studies that we've done, it really depends on the advisors, the people that are advising politicians and also the system. There are very good examples of very good relations. Like I think Dr. Chiu talked in Singapore. They have a very good relation with the science and the policymakers. I think so. So one needs to also understand that the other problem also facing policymakers is that the science is inexact. As you know, when even about herd immunity, today I think Professor Heeman really pointed out very, very acutely. When people start talking about herd immunity, I said, what is this herd immunity? What's the basis for this 70%, right? So exactly the things that we talk about, and everyone just talks about herd immunity and doesn't question it. So you see that we also have problems in the science in terms of the inexactness, some of the stuff that we're doing, and of course, some of the knowledge is not there, right? We are only beginning to understand some of the issues in terms of the transmission, the things that we need to do, the continuation. So really to understand there's some of these things that we do not know, but policymakers have to make decisions. They cannot wait for the clinical trials. They cannot wait from the experiences. They've got to have the best information available. So how do we provide that? So we as scientists need to look at that. And this policy decisions are not just based on one science. We only, what you talk about, the hierarchy of science is the biomedical sciences. There are policy sciences, communication sciences, human sciences, social sciences, and all of those feature in decision making. So I guess we need to understand, because I think it's actually did talk about the multidisciplinary nature of some of these inputs. So I guess we need to be more retrospective and introspective in terms of some of the things that we accuse policymakers of. Right?
Thank you very much, Professor Yao. And now I would like to invite Professor Teo to answer the questions.
So I think our colleague from Brazil asked the question around essentially long-term symptoms of COVID-19 or long COVID, and what was our experience in Singapore. I think Singapore, like Hong Kong, we have been very fortunate that we put in place the necessary measures to keep COVID out of Singapore for the first 18 months of the pandemic. Both Singapore and Hong Kong, we have been very privileged that not a lot of people in our territories were infected with COVID-19. So we didn't actually see that many episodes of long-term COVID symptoms or long COVID. But what I wanted to make this point about what was our privilege and fortune in the beginning is now turning to be our problem that we need to address, because fundamentally, a large proportion of our people in Singapore remains naive to COVID-19 because they've never been infected with COVID-19. So there was no natural immunity to talk about. So right now, even though we have vaccinated quite a lot of our people, I mentioned 84% of the population is fully vaccinated, which translates to about 93% of all the eligible people for vaccination. That is a very high vaccination rate, but we continue to see thousands of cases happening in Singapore on a daily basis. And the reason of that is because most of our people have never experienced COVID-19, even though the vaccine is able to protect them from disease and deaths. The current vaccines are insufficient, as Professor Heeman has mentioned, to protect against infection. So we are starting to see that we need to go through this phase of infection. Now, in terms of long COVID, I think because of the timing is different. In Brazil, I believe Brazil experienced quite a lot of infection before the vaccines were able to be distributed in the population. So that's where people are unprotected against COVID-19 and they experience that long-term COVID symptoms. Whereas for us, our large population now, we're starting to get quite a number of people infected with COVID-19, but because most of them have been protected by the vaccines, we haven't really seen that many episodes of people with long-term COVID, despite the fact that in the past 1 month, we have seen about 100,000 cases. Over back to you, Chair.
Okay, thank you very much. I think this, we still have 2 minutes. Is there any comments for this 7 outstanding speakers for their very great talk? Yes, Joachim, please.
Thank you. I would like to go back to David Heyman and ask the question, developing countries, low-income countries are quite diverse. And we had the big example of India, an emerging economy. Then Mr. Barroso gave us examples from various African countries, including small ones like Togo. Can you frame your main messages by typologies of developing countries and which ones did well, and is there learning across the regions within Africa, South Asia, and Latin America?
Thank you. Thank you. I'll try to answer, first of all, by saying that countries where the governments were committed to dealing with the problem and countries which listen to public health advice are the countries that have done the best. And that includes Asia, that includes Latin America, and that includes Africa. South Africa, for example, has regular weekly meetings of all of their public health people and listen to the guidance that they provide. Other countries in sub-Saharan Africa have not seen that COVID is a problem compared to other infections, and so they've been less engaged in providing for COVID. But what will happen is that as countries continue to deal with this virus, if they have no measures to decrease transmission, transmission will increase quite rapidly in their countries, and population immunity will develop not from vaccines, but from natural infection. And hopefully that natural infection will then protect people when they're reinfected from serious illness and death. As you know, there are 4 endemic human coronaviruses at present. This will be the 5th one. And those 4 coronaviruses, some of them may have been very virulent at the start, but as population immunity developed, they become viruses which cause the common cold and which can reinfect people from time to time. So that's in the long term what we could anticipate seeing. But in the short term, the governments that will do best are those governments which commit to requesting vaccine from the ACT Accelerator COVAX facility, for example, and those countries that do testing strategies, which will limit the size of outbreaks, but not stop them. I hope that's answered your question. Thank you.
Thank you.
Thank you. And Dr. Peter Revens has a question. Peter?
No,
Yes,
really
Dr.
a general comment. The sort of inequality between nations that's making response to COVID so difficult is the same kind of inequality that's making reaction to climate change, saving biodiversity, and so forth so difficult. In the spirit of what Jesus taught us in the Bible about paying attention to the poor, it's worth noting that the richest nations in the world will stay that way, show little attention to the poorest nations in the world. And if we want to deal with problems systematically in a world that has 7.8 billion people now with about 2,000 of them owning as much wealth as the 4.6 billion poorest. We've got to find ways to take the admonitions of Jesus and of the Pope seriously and really pay attention to the poor. It's not enough to rush in with vaccines when people get sick. We've got to get their countries to a point where they can operate like ours, overcome the inequalities that are so evident in global footprint network analyses, for example, and learn to love one another properly. Otherwise, it's always going to be a Band-Aid at the last moment. Just a footnote, continued research on virus-caused diseases, much of which was pointed out brilliantly in Francis Collins' lecture, and much of the promise was implied there, must be sustained, but equality between nations will be necessary before the world can ever dream of attaining sustainability, response to diseases, prevention of climate change, the preservation of biodiversity, or indeed the preservation of civilization. Thank you.
Thank you very much, Peter, for your very important comment. And I think this time is up, and